Hello, everyone. This is Chris Rosselli, Nonfiction Fitness, and I am here today with part 2 of Immune System 101 with my good friend and colleague, Dr. Chris Davis, MD. Chris, how you doing today?
Doing well, Chris. Always good to see you. Good
Awesome.
to be
Great to
back.
see you too, man. Great to see you too. And Chris, before we got the recording hooked up, took me through this presentation, and it's amazing. You guys are going to really like it a lot. You're going to learn a lot. You're going to feel empowered afterwards. And I think one of the cool things that you're going to find out about today is, which I think will be really cool to you as well, is you're going to get the answer to the question, why do people with compromised immune systems and pre-existing conditions do worse with infectious diseases like COVID-19? Chris is going to explain the physiology behind that, and it's going to be very fascinating to you. And then also from that, you're going to also understand how your immune system's dysfunction can also contribute to chronic degenerative diseases, things that maybe you're already struggling with, like heart disease, diabetes, even things like cancers, because all these things are interconnected. So pull up a comfortable chair, grab yourself a cold beverage, and lock your focus in, because you're not going to want to miss a second of what Chris has to share with you today. So I know that's a lot of pressure I just put on you, Chris, but go ahead and do your thing, man.
All righty. Thanks, Chris. Well, he didn't tell you that I told him I put this together in an hour right before we got on this call.
You'd never know it. You'd never know it.
So if you guys, if there are any misspellings in here, just realize that we put this together the hour before. I put this together the hour before we just got started with this webinar. So, anyways, but I think this is a really great topic. One of the things we did last time with our conversation is we talked about the immune system. How does the immune system work? With COVID-19 and all of the fears that are out there about COVID-19 and am I at risk, and why are certain subgroups at higher risk of actually dying from COVID-19? We talked about the immune system and its role and kind of what happens. And so I just want to recap briefly the immune system and what happens in the immune system. So we'll kind of start with what we talked about on our last webinar. We talked about having three different parts of our immune system. One, we start out with the anatomical and physiological barriers, things like the skin, the cilia or hairs in our lung, airways, the stomach. The acid in our stomach is very important for actually modulating immune system and fighting off infection. And then the lysozymes, or the enzymes in our tears and saliva, also very important. The second portion of our immune system, which is actually what we think of as the first responders, is what I call them. The innate immune system consists of things like all of our white blood cells, the natural killer cells, macrophages, neutrophils. These are the cells that when we're exposed to a pathogen, these are the cells that kind of initially see that pathogen and start sending out the alarm. They're sending out the alarm and, hey, something's here that's not supposed to be here. And so as they send out those signals, they're sending out signals for these neutrophils to come in, and these neutrophils come in and they engulf whatever that pathogen is. They kind of come in and just, the bigger word is phagocytize. They kind of eat up that pathogen and then actually and destroy it. At the same time, they actually elicit another response where they eat up the pathogen and they then stimulate the second part of our immune system called the adaptive immune system. And that's what we call our B and T cells. I'm sure you guys have probably heard of B and T cells, and T cells come in different forms as well, but T cells are also there to help destroy these toxins, and they're more of a secondary response and kind of occurs days to weeks out, as opposed to that innate immunity, which happens within hours. B cells are those cells that then produce things called antibodies. I think you guys hear a lot now with the COVID-19. We talk a lot about antibodies and the antibody test, right? So what are we talking about? With the COVID-19, we're looking at whether if you've been exposed to this virus, then you should have developed an antibody response, right? We have an IgM and IgG, which are both types of antibodies. That IgM occurs first and IgG occurs second. And so what we're looking for with that COVID-19 test is have our B cells produce the antibodies to this virus. So were we exposed to it or not? And I'm just going to say as an aside, and you guys are going to hear more of this, I'm sure, we're doing this testing in my office, and it's amazing the number of people who had not a symptom that they knew of that are testing positive for the antibody test that had a disease. So that's just kind of a side note. But so this is our immune system. This is how we respond to pathogens and infections. So I want to use this response here. I want to look at this acute inflammation response here, but then I'm going to use a splinter as an example. When we get a splinter in our finger, okay, that splinter typically will have some pathogens, bacteria on it, and those bacteria get into our system. And again, we talked about our cells. Those first cells are the innate immune system, right? The mast cells. These phagocytic cells are also the neutrophils. Another word for that is neutrophils. So the mast cells send out these signals, which then tell the neutrophils to then come in and say, let's get rid of all these bacteria that we exposed to from that splinter. So the neutrophils come in and they start just gobbling up all those pathogens. And after they've gobbled up the pathogens, and here where it becomes very important, I want you guys to get this, okay? The difference between acute inflammation and chronic inflammation is what neutrophils do is they come in, they phagocytize or they eat up these pathogens. And then there's this control response where these other cells come in called monocytes. Monocytes turn into macrophages, and something has to then actually eat up or take care of these neutrophils. Now, monocytes and macrophages turn into macrophages and come in, and they then gobble up the neutrophils and get rid of it through the lymph system. However, if that neutrophilic response is so overwhelming that there are not enough macrophages or monocytes that get in to take care of it, instead of undergoing this, what we call a pre-programmed cell death, that what happens is those neutrophils go through a programmed cell death called apoptosis. I don't want to go into too many big words, but that's what normally happens and resolution occurs of this inflammation. Well, if that doesn't happen, what ends up happening is these cells don't go through apoptosis, they become necrotic and they burst, they rupture. So what happens when this neutrophil ruptures? It exposes all of its contents then to this area of tissue. So this content has a lot of enzymes and more of this bacteria. So this then causes more and more and more inflammation. So what happens? There's more inflammation, there's more pathogens, more neutrophils have to come, more neutrophils have to come. So we still don't have enough monocytes and macrophages. So then what happens? More necrosis, more inflammation, thus sets up this entire cycle of chronic inflammation, all right? Chronic inflammation is the root of many, 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 many illnesses. Chronic inflammation is the root of heart attacks, cancer, Alzheimer's disease, diabetes, rheumatoid arthritis, thyroid disease. Chronic inflammation is the root of, every condition I can think of. So what we need is a balanced immune system. So our immune system is great. An inflammatory response is great when it goes through the resolution phase appropriately. When it's overwhelmed, not so great, right? So
yeah, let me just pause you right there, man, and let me just add something real quick. So if you could just go back to that previous slide, I think something's worth pointing out there. So this is an example in the skin. This is just one type of tissue within the body that can have something like this happen to it. In fact, every tissue in the body can have this happen to it. This can happen to the nerves in your brain. This can happen to your muscle tissue, to your tendons, to your ligaments, to your bursa sacs. This can happen to your heart tissue, to your blood vessel walls. You know, basically, if there's anything that creates any kind of tissue damage, this process is going to occur within that tissue that was damaged. And so don't get too caught up in the specifics of this example. Realize that this is what happens everywhere. Just wanted to point that out.
Very good point. Absolutely. In fact, that was one of my points I was going to make. We use the skin as an example, the gut. I mean, everything that you just said, Chris, is absolutely right. Remember that this occurs in all of our tissues. People who have irritable bowel syndrome or inflammatory bowel disease, the Crohn's disease, and you're having a lot of issues with bloating in your stomach. Any of these tissues, this same process is what we're talking about happening with the chronic inflammation. Mm-hmm. So,
and like many of my clients, you know, that's the process that's going on in their shoulders or their knees or their back or their neck. You know, maybe a muscle tissue got some damage on it, and that inflammatory cycle is going nonstop in that area. You know, so yeah. So
Absolutely. The
Awesome.
chronic
Keep going.
pain issues related to that. Absolutely right. Absolutely right. So what I want to point out now, we're going to talk a little bit about the relationship between inflammation, chronic inflammation, and oxidative stress. You guys may have heard this terminology, oxidative stress. And I know even as a physician, a lot of times oxidative stress, well, we know it's not a good thing, but what is oxidative stress? Well, we're going to talk about that in just a little bit, but more importantly, there is this direct relationship or really this complex interaction between inflammation and oxidative stress. Inflammation causes oxidative stress. Oxidative stress causes more inflammation, and you get this kind of snowball effect of one thing making the other thing worse, and then again, the snowball gets bigger and bigger and bigger. The more inflammation, the more oxidative stress. The more oxidative stress, the more inflammation. And so I'm going to go back and I'm going to use the example of COVID-19 really quickly. The one thing you guys will remember, and I'm going to go back a few slides because I skipped it. The one thing you remember about COVID is that who are the people who are succumbing to COVID-19? Who are those? What are those groups? We know now that it's the people who have, and you would have thought that it was the people who had lung disease, right? It's a disease where we have this ARDS and pneumonia. So it's the people who have lung disease that are going to have the most issues. Well, we now know that that's not true at all. It's the people who have underlying cardiovascular disease. It's people who have hypertension, who are overweight, who have diabetes, who are developing and dying from COVID-19. Well, why is that? These are the people who have the most inflammation at baseline. These are the people who have the highest oxidative stress levels at baseline. So when you're starting out at an inflammatory level of X, as opposed to the person who has a much lower inflammatory level, your body doesn't have much more, you don't have much leeway. You don't have much more to go before you get to a point where your body is overwhelmed with these inflammatory cytokines. You guys have heard that comment about cytokine storm. We hear about that. I mean, that was the big term when COVID-19 first started. Cytokine storm is much more apt to occur when you don't have that room when you're already starting at an inflammatory state where those cytokines are already elevated. So those are the people who are having the worst outcomes with this COVID-19, the people who have the highest oxidative stress levels.
Wow.
So
You know what the visual is that comes to my head is somebody walking up to a guard at a building and distracting them while their buddy sneaks in and tries to rob the place.
Right.
You know?
Right.
And you know, and our guards have been so distracted by fighting hypertension and fighting the inflammation associated with these different things that things like COVID are just slipping right in and just robbing us of our health and sometimes our life.
Absolutely right. You know, COVID-19, and I think the last talk that we did, Chris, I entitled it, COVID-19 Insights and a Wake-Up Call for us all. And it really is a wake-up call. And every time we do these talks, I'm using this COVID-19 because it really is a wake-up call for us to understand what's going on with chronic diseases, why we're ill, and now we see these people, they don't have much room they don't have much leeway at the top. They don't have any room to get much worse because they already have all these underlying issues with the oxidative stress. So let's move on. Let's talk a little bit about oxidative stress. What is oxidative stress? I mean, it's a term that it really is hard to define. So when I talk to my clients, it's really, I use one example and one example only. This came to me in the middle of the night one night and I couldn't sleep. So I use this example of rust in a pipe, right? I think about, oxidative stress is your body is rusting inside out. As we age, we all have more oxidative stress. Part of getting older is oxidative stress occurs. And that what ends up happening inside, you think of an old lead pipe or iron pipe as it gets older, all of the oxidation inside of it, the iron oxidizes and you get this buildup inside that inside of that pipe that looks something like this, right? This is oxidative stress, right? And I found this book. This was kind of interesting, and I put this here just simply because it says it very well. Rust is oxidation that turns aluminum white, copper green, and steel brown. It's costlier than all other natural disasters combined, amounting in the U.S. alone to $437 billion a year, which approaches 3% of our nation's gross domestic product. It's been called the Great Destroyer, the evil. The Pentagon refers to it as pervasive menace. It destroys cars, fells bridges, sinks ships, sparks house fires, and nearly brought down the Statue of Liberty. This is pretty, when you look at rusting and oxidative stress, it's pretty important, right? And pretty serious. Well, I'm going to tell you, look at this, okay? This is the inside of an artery, right? Oh. Very similar, right, to that lead pipe. This is the inside of an artery of a person who, this is somebody who actually had a heart attack. If you guys look at this, this is a ruptured plaque right here. So actually, this is the inside of an artery that has grown this plaque, and the outside of this artery is just kind of this, if you kind of see where my cursor is, that's what that artery really should look like. All of this stuff is plaque that's grown into this vessel because of increased inflammation and oxidative stress, right? It's the same principle as that pipe that I just showed you. You're rusting from the inside out, and oxidative stress is what's causing it. So I guess the next question that most of you guys probably will have, well, what the heck is causing oxidative stress? Why? What is it? Well, these are the things that we all should be talking about. Smoking, the diet, medications that you're taking, air and water pollutants, fast food, stress, pesticides, alcohol, exposure to other toxins like heavy metals, too much exercise, believe it or not. You know, Chris, you love to exercise. I know I do too. I joked with my trainer this morning. I said, man, I've got too much oxidative stress. I got to slow down. But you can over-exercise and have too much oxidative stress. But the bottom line is these are the things that contribute to oxidative stress. So when we start to teach you, okay, well, how do I optimize my health and make sure that I have, that I'm not too overly stressed and have too much oxidative stress and inflammation built up? These are the things you need to be thinking about. Now, there are ways, and we'll talk a little bit about this in a little bit, there are ways that certainly we can measure and see how much oxidative stress that you have in your body. And those are things that each and every one of you really should know so that you can address what those potential issues are that have triggered this oxidative stress. Because a lot of times we don't really know. You know, if you've been exposed to heavy metals and don't know about it and have a lot of oxidative stress, wouldn't you like to know about those things? Water pollutants, wouldn't you like to know about those things? So those are the things that I think that from a functional perspective, when I think about heart disease and my treatment regimens, when I approach my patients, these are the things that I'm thinking when they have heart disease. How do I assess these things and whether these may be contributing to their heart disease? Not just cholesterol. And we're going to talk about that in just a little bit.
Wow. So now, just before you go on, let me just have you address what I think is kind of an elephant in the room, which is that many people watching this might be thinking, I've never heard any of this before. I've never paid attention to it before. I've never tried to do anything about this before, and I've made it this far. Why should I bother doing anything about it now?
Mm-hmm. Well, I mean, so remember, we're talking about, so first of all, I'm using a lot of heart disease examples here, but ultimately what we want each and every one, everybody who's listening to this, we want you to be the best version of yourself. We want you to have not a lifespan, but a health span. And I think what our goal is, Chris, you and I both, is we want to create a health span of every individual where you live to you're 90 years old and you're cognitively there, your heart health, your brain health, your joint health, you're still exercising. So yeah, you've lived to where you are now, but how much better and how much longer could you have with a health span that's phenomenal? And each of us, we don't know, but I can tell you, if you're living with high oxidative stress levels, they won't be as long as it could have been. So we want you guys to understand what these factors are, what needs to happen. Really, again, we want this to serve as a wake-up call so that each and every one of you guys know, okay, what questions should I be asking? And if it is a problem, what do I need to do about it?
Mm-hmm. And also, just speak for a second about the other layer of benefit that people will get from following this program, which is that they'll feel better every day that they are alive. Speak to that for just a quick second, how that is affected by this.
I think as a physician, you know, before I really got into more of the integrative cardiology and really helping people understand nutrition and exercise and the importance of sleep, you know, one of the things that I heard over and over, day in and day out, and I think that probably a lot of the people that are listening to us right now, is that I'm just so tired. I wish I had more energy. I can't sleep. I just keep gaining weight and I'm doing everything right. I don't eat. I eat one time a day. Those are the kind of complaints that I heard day in and day out and really didn't have a great answer for, right? And as I started to really understand some of these concepts that I'm talking about now, the importance of nutrition and micronutrients, you know, I really started to see how it was important that, you know, our goal here is to teach each and every one of you guys how to be the best version of yourself. And I think there's been a lot of miseducation out there. And the biggest problem I see, even as a physician, we weren't taught these things that I'm teaching you now. A lot of the things that I'm saying about the nutritional part and the pollutants in the air, none of us were really taught to really, they weren't important as part of our treatment regimen. And so I think it's important for us to bring light to all of these things.
Yeah, absolutely. Well, and I know for me, you know, when I started making these kinds of changes in my life, it changed the way that I felt dramatically. I mean, more energy, more focus, more drive. And, you know, I'm younger than most of the people that are watching this, but your body physiologically, you know, in general functions the same at every age. And so if you do these things at 90 or you do these things at 30, you're going to get a lot of benefit from it.
Yeah. I think
So
one of the things that we've all just decided to accept, and I hear this all the time too, I'm just getting old, right? That's not, getting older doesn't mean you can't do the things that you were doing before. I'm just getting old is an excuse that we've all decided that, who decided that we had to retire? This is getting a philosophical question. Who decided that we retire at 65? Why do we retire at 65? Because we're getting older. I mean, we don't have to. It's a mindset thing. And so if you optimize all these things that we're talking about, I mean, like I said, we're talking about health span. We don't have to be old at 65. I fully intend that when I'm 65, I'm going to be working 75 and 85. And I think it's a mindset change. And if we change that mindset, you know, and more people start to change that mindset, we start to move that dial to 75, 85, maybe old as 85. But I can tell you right now, 65 is not old. But I think a lot of my clients, you come in, oh, I'm tired. Oh, my joints hurt. Well, they don't have to hurt because I'm 65. And that's an important point to make, I think.
yeah, absolutely. Yeah, choices matter. Yep, you reap what you sow. So I'm looking at this chart and I'm seeing a lot of diseases that I'm sure a lot of people on this video have. Why don't you tell us a little bit about this?
So, you know, really the point of this is exactly what you just said. My point with this is to understand that oxidative stress is not just a heart disease thing. It's not just a arthritis thing. It's not just a diabetes thing. Increased oxidative stress and inflammation is the underlying root cause of all chronic illnesses. So if you look on here, I challenge you to find one thing that's really not on here. So understanding how we control inflammation is super important. And so again, the point of this is that, you know, and I think that the other thing that I'm seeing in practice right now, everybody is really, really, really scared of dementia, Alzheimer's, Parkinson's disease, and rightly so, right? Rightly so. But I think that one thing that we're learning more and more and more that Alzheimer's and Parkinson's disease is an inflammatory disease, just like everything else. And so controlling that inflammation and oxidative stress is super important.
Yeah. So your brain doesn't rust, right?
So your brain doesn't rust. Using this immune system talk gives us a platform for you guys to educate yourself about, yes, the immune system is very important in fighting off infection, but the optimizing your immune system and the immune system resolution of this inflammation is also very important. And we're doing things to ourselves from our lifestyle that are not allowing that resolution phase to be completed appropriately.
Wow. And paying a big price for it.
A major price for it. The next slide, I think I'm going to go in just because heart disease is obviously my specialty. And I want to make an example out of this. The point I want to make here is we've talked a lot about oxidative stress. We've talked about inflammation. And we know cardiovascular disease is the #1 killer in the world, #1 killer in the United States, and has been year after year after year. When we think about the risk factors for cardiovascular disease, I'm sure that each and every one of you, we know that, okay, if my cholesterol is high, I have a higher chance of having heart disease. If I'm a smoker, I have a higher chance of having heart disease. If I have diabetes, if I have hypertension, I have a higher chance of having heart disease. If I'm a male, I have a higher chance of having heart disease. If I'm getting older and I'm 75 as opposed to 45, I have a higher chance of having heart disease. But what about all these other things on this list when I think about the risk of heart disease? What about immune system dysregulation? What about an imbalance in that immune system that's going to cause too much inflammation? What about having sleep apnea? What about social beliefs? What about lack of belief? What about chronic stress, right? These spiritual factors. What about, let me go back over here, genetic defects, heavy metals. All of these things are really important when we start to think about the risk for heart disease. And we should be thinking about every one of these things. Let me go down to something that I think is really important that we never really talk about. Your essential fatty acids with omega-3s, fish oil, and vitamin D. Okay? Do you know that most insurances won't even pay for a vitamin D level? And vitamin D is a super important anti-inflammatory agent. Very, very, very important. You should have that measured on every single patient. But most insurance companies don't cover it. So these are the things when we talk about underlying dysfunction or cardiovascular risk factors, every single one of these things should be evaluated. So I call this slide missing the forest for the trees, because I'm going to use this as a point, and I want all of you guys to talk to your doctors about this, because this is something as a cardiologist kind of infuriates me. We harp on the cholesterol levels, and our cholesterol levels need to be less than 200, and if it's above 200, I have a high chance of having heart disease, right? The reality is this, and know this, 60% of the patients having a heart attack and stroke have normal cholesterol levels. 60% of people who have heart attacks, okay, have or strokes have normal cholesterol levels. 50% of those patients with heart disease have no other risk factors, right? And then your LDL, or what we consider our bad cholesterol. All of us know our LDL is our bad cholesterol and our HDL is our good cholesterol. Well, the LDL is about 25% of the risk of premature coronary heart disease, makes up 25%, okay? But yet we harp on our LDL numbers and HDLs being high and LDLs being low. So this is a great example. This is a lady, okay, who has a pretty good cholesterol panel. Her cholesterol is 158. Her LDL is 101. Her HDL is pretty good at 53. And triglycerides, which are another form of fatty acids, also important for risk of heart disease, is 70. All these numbers look pretty good. So when we look at these cholesterol numbers, and I can assure you probably 90% of you guys, when you have cholesterol panels, these are the numbers you get. This is a low risk person here. But what did we just learn? What did we just talk about with heart disease? What did we talk about with oxidative stress and inflammation, right? Inflammation is the root of what happens in heart disease and blockages in the arteries and oxidative stress. So there's technology and there are tests, and they have been for years, that we can measure how much oxidative stress or how much inflammation we have going on in our arteries. Oxidized LDL is a measure of that. Your high sensitivity CRP is a measure of that. This lipoprotein phospholipase A2, another measure of that. And as you have more and more of these, and as these levels increase, we can kind of see, as these levels increase, the amount of plaque in those arteries correlate to how high these levels are. So if we are able to measure these levels, as opposed to just checking your cholesterol, this would be incredibly beneficial. And so here's a great example of what that looks like. When we do a test called an advanced lipid panel with inflammation markers, here's a great example of that, all right? So we measure this lipoprotein phospholipase A2, it's extremely elevated. Her inflammatory marker, this high sensitivity CRP, extremely elevated.
Wow. This is the same person, right?
This is the same person. So we got normal cholesterol, but super high risk inflammatory markers showing that if we didn't look at these, oh, everything looks good, you don't have to worry about it, your risk for heart disease is very low. When in fact, her risk for heart disease is tremendous because she has so much chronic inflammation and oxidative stress. Wow. So this is the type of information, as you can see here also. I pointed out vitamin D, 21, super low. Vitamin D levels should be somewhere in the order of 70 to 80. I'll tell you here, if you go to your doctor and by chance they do order it, vitamin D levels will often come back around 30 or 31. That's not normal. Your normal levels on labs, even on this lab, says 29.9. That's not normal. You want your vitamin D level to be 60, 70, 80. That is a vitamin D level that's going to help you fight infection. So here are a lot of the markers, and we don't have time to go through all of these markers now, but I'm just pointing out a few of the markers when we do an advanced screening, how we pick up these early risk factors for heart disease and how you truly prevent heart attacks. It's not about looking at cholesterol numbers. I'm an interventional cardiologist. I put in stents for 15 years. We missed the forest for the trees. I put a stent in, you come back 6 months later, we do it again, because you have to look at this entire picture and treat the underlying cause, not put a stent and a blockage that's already there and then let it come back again.
Wow. So for someone that doesn't have, at least they don't know that they have the makings of heart disease, would this still be a good thing for them to have done?
Oh, absolutely. This
prevention of other things?
Even better. this is the person who should have it. Every one of my patients, regardless of whether they have heart disease or not. In fact, if they haven't heart disease, you still get this panel. This is the panel you get because the whole goal is to be preventative. This is true preventative cardiovascular medicine. We check this with everybody. You pick this up, and I can't tell you the number of people who I have a lot of 35 and 40-year-olds who come in with these levels extremely elevated. And believe it or not, a lot of this is genetically related as well. It has a lot to do with that. I don't have a lot of time to talk about genes today, but precision medicine is everything. They have a lot of issues with this apolipoprotein E, right? You're eating a high saturated fat diet with this apolipoprotein E, your oxidized LDL and this LPPLA2 are going to be high. I can't tell you the number of people. I found that a lot of people are on a ketogenic diet. I don't dislike, in fact, I like the ketogenic diet. I don't like it for people who have an apolipoprotein E genetic SNP or probably more variant, because they should not be on a high saturated fat diet because of things like this. So so from a preventative standpoint, this has been tremendous. And the people who've come in and we've picked this up, and 6 months later, after I've changed their diet to a Mediterranean or plant-based, and watched these numbers just plummet, because I've based it on the genotypes and I saw this happening. This is truly preventative medicine. I can't tell you that I prevented them to have a heart attack, but I feel very confident that I did, because I saw what we saw way upstream and we changed it before it happened.
Yeah. Well, and for all you guys watching, don't forget what Dr. Davis said earlier, which was that inflammation is the main contributor to all forms of degenerative disease. So if these are high on you, you got a higher risk of cancer, you got a higher risk of diabetes, you got a higher risk of stroke, you got a higher risk of everything. So definitely, I would say get this test done if you've never had it done before, because you got to know this stuff. You can't manage what you don't measure.
Right. Let me chime in there, Chris, too. Let's just take this for example. We talked about, I'm using these inflammatory markers for heart disease. I talked about vitamin D for inflammation. Same thing with the people that you see with chronic joint issues and stuff like that. This vitamin D and these inflammatory markers, the inflammatory markers tells us that they have increased inflammation, they have increased oxidative stress, which is probably contributing to the same symptoms we just talked about, all the aches and pains that you're having. Same thing with vitamin D, super low. I can guarantee one of the biggest things I've seen over the last 2 years is the amount of osteoarthritis, rheumatoid arthritis symptoms, even things like psoriasis, the skin issues get better by just fixing the vitamin D because of the anti-inflammatory properties. I can't even tell you the number of times. So this is the kind of thing, I'm looking at it for the heart perspective here, but it's going to help me in a lot of other ways from an overall wellness perspective.
Mm-hmm. So I hope everybody watching that caught what Dr. Davis just said. If you've got pain, if you got osteoarthritis, if you've got other types of musculoskeletal pain, this is definitely something that you want to have checked out, because you might be low in something that you need to be higher in, and once you're higher in it, that might reduce your pain. Right? That's basically what you're saying, right?
Yep. We could go down through a couple more of these. Same thing with the omega-3s, right? Fish oil is a very potent anti-inflammatory agent. If your omega-3 levels are really low, then we need to optimize that. We need to get you on more omega-3, whether it be from fish oil or some of the more algal-based products that have omega-3 as well. So, there's a lot that we learn from here, not just from a cardiovascular standpoint, but again, from just an overall wellness perspective.
I can't imagine anything better going on in my body than low inflammation, low risk of cancer, low risk of heart disease, low risk of infectious disease, feeling good all the time, being able to physically do what I want because I've got everything working the way it's supposed to. I hope everybody watching would agree with that. If you do, definitely get this test done. Start there.
All right. So I'm just gonna finish up here. I really, at this point, the question is, okay, well, if I have all these things, what do I need to do? And my practice, I really teach basically the 5 pillars of health. All right. We talk about nutrition. Obviously, that's very important. Understanding what good nutrition truly is and busting a lot of the myths that are out there. Super important. Detoxification. That's really important when we start to talk about oxidative stress. That oxidative stress is typically caused by a lot of the toxins we're exposed to, the heavy metals, the pesticides, all those things we just talked about, the alcohol. So detoxification and optimizing your liver and gut function so that you can get rid of those toxins. Most people don't even think about, that's kind of a term that, I know what detoxification is, but what does that truly mean to get my body to an optimized state where it detoxifies itself? Sleep, again, very, very overlooked, very important. The connection between the immune system and sleep and inflammation is tremendous. Okay, and so we really want to make sure that we're getting optimal amounts of sleep. Fitness, activity, movement, super important. Again, as far as our overall health and well-being, Chris, I mean that's I know your strengths and your passion. And lastly, balancing our stress and hormones. I will say that, you know, stress comes in all forms, right? Stress comes in emotional stress, chemical stresses, physical stress. We tend to think about stress mostly from the emotional perspective, and it does affect us tremendously from a chronic inflammation standpoint. Emotional stress is a huge factor as well. And understanding how to deal with emotional stresses is really important, whether it's meditation, whether it's yoga, whether it's whatever the mechanism by which you can de-stress. That is very important because that has a tremendous effect on our immune system and how our immune system responds normally and resolves underlying chronic inflammation normally as well. So these are the 5 pillars of health that, I mean, if you guys, we build around these, and once we optimize each one of these 5 pillars, that's when you're truly going to reach that true optimal health span that we talked about.
Love it. And
So
what a great setup for the next video too.
I'm going to end with this one. You know, I love the analogy of the pipes, and I want you guys to ask yourselves these questions. How are your pipes? I want you guys to think about what we just talked about with chronic inflammation, but it's much more than just the arteries, right? We're talking about what are your oxidative stress levels? What are your inflammatory levels? What do you need to do to improve those if they're not at a place where they should be? And so having said all that, here's my contact information. We're going to be doing more of these talks. We're really excited to be bringing a lot of the education piece to what we do with my practice, Reveal Vitality. So here's our contact information. You guys write it down. If you're interested in actually having a consult with me, just call this number and we'll be happy to kind of get that set up. You can also reach us at info@revealvitality.com. And if nothing else, you can reach out to Chris. Chris and I talk very frequently. And we'll be bringing more to the Sarasota area very soon, and some of the things we're going to be doing.
Awesome. Yeah, so once again, you guys, I just really encourage you to reach out to Dr. Davis and have this test done. And also, if you haven't watched our previous video, go ahead and watch that. It's on my YouTube channel. It's also on my website. And in that video, Dr. Davis talks a little more in depth about the different components of the immune system. And then he also talks about what goes wrong when you don't have enough vitamins and minerals within your system. And if you haven't watched the last video, you'll really have your eyes opened once you see it. So definitely encourage you to check that out, get that test done as well. And yeah, anything you wanna add, Chris, before we say goodbye to the folks?
No, I think, I mean, I appreciate you guys' time. I hope you will use this COVID-19 as a wake-up call to really, I'm hoping that this will help wake up our entire country, the entire world about truly taking better care of ourselves and some of the exposures and lifestyle choices that we make that really lead to these chronic illnesses. And I think that hopefully we will start to, we see more and more cancer, more and more heart disease, more and more dementia, and we don't have to do that. I mean, it's going to take some lifestyle changes. It's going to take some changes too, because our society is set up that it allows a lot of this stuff to be propagated. And I won't get on my soapbox about that, but the quality of our food, it shouldn't be what it is, but it is. So again, that's part of the education we can do. You do have choices to make. And if you don't know any better, you likely are making some of the wrong choices. And so that's some of the things we'll be talking about in the future as well.
Yeah, so you guys are going to want to definitely keep your eyes open for the next video, because we're going to go in depth into some other things that can help you build a better, stronger, healthier immune system. So Chris, thank you so much for your time today, man. I know you're super busy, but you've been super generous to avail yourself for these. Everybody at home, have a great rest of your day. God bless you, and we will talk to you again soon.
All right. Bye-bye.